The Global Fund to fight AIDS, tuberculosis, and malaria, launched in 2002, grew out of the response to the HIV/AIDS epidemic, which gravely threatened Eastern and Southern Africa. This public-private partnership, a new international finance instrument, answers the unmet needs of millions of people in the developing world threatened by these three deadly infectious diseases. The fund makes grants based on what countries themselves define as their priority needs. It draws support from the United States, France, the UK, Germany, Japan, the Bill and Melinda Gates Foundation, and others. It has approved nearly $28 billion in grants to more than 140 countries. By law, U.S. contributions to the fund cannot exceed 33% of the total, a smart provision that leverages support from others.
One of the things we've done recently is to structure our own commitment to the fund such that we're laying down a challenge before other countries. And we are seeing a lot of the fund's traditional partners maintain their commitments, and many of them increase their commitments. We're seeing some new countries step up.
2 years ago, the fund was restructured, which resulted in a new funding model, new leadership, and reformed management. Today, the fund can point to dramatic health gains achieved through a unique partnership model.
The numbers are huge. 9 million lives saved. That's 5 million people on AIDS treatment, 11 million treated for TB, 340 million bed nets distributed to protect against malaria. But really, it's when you get on the ground and into communities that you see the real human impact of the Global Fund.
An entire continent was caught in the pandemic's merciless grip.
The United States has been critical to the Global Fund's success, starting with the Bush administration's initial investments. The fund relies on both bipartisan congressional support and White House backing. Operationally, the fund works increasingly hand-in-hand with U.S. AIDS, TB, and malaria programs.
It's global, and we believe that unless and until the entire world is mobilized, we won't get ahead of any of these three diseases. But if the global community is globalized, we can get there.
The U.S. government remains the largest donor to the fund, pledging $9.5 billion since 2001. It arranged to host the fund's 3-year replenishment in Washington in December 2013. Much work remains. More than 16 million people in developing countries still require HIV/AIDS drugs. There is need for expanded tuberculosis and malaria programs. In the face of tightened budgets, the fund will need to continue demonstrating it is getting the best bang for the buck in improving the health of the world's neediest. It will need to further strengthen its transparency, and it will be pressed to effectively confront TB and malaria resistance, two increasingly tough challenges. But there is reason for continued optimism. With sufficient resources, dynamic leadership, and continued support from the United States and others, the fund will be well positioned to continue addressing the world's three most deadly infectious diseases.